Welcome to the annual recertification application video. I'm going to walk you through how to complete the Michigan Drug Assistance Program recertification application. But before we begin going through the application, let's review the items you must include before you submit it to the MiDAP office. Proof of residency. You must submit proof that you are a resident of Michigan. You can make a copy of any one of the following items to include with your annual recertification: a current state of Michigan identification card or your driver's license, a utility bill in your name showing your address, a benefits award letter from the Michigan Department of Health and Human Services, Social Security Administration with your name and address, a lease or mortgage in your name showing your address, or a voter registration card. Proof of income. You must submit proof that your income is between 138 and 450% of the federal poverty level, or FPL. If you need help calculating your income, look for the FPL calculator link in the presentation resources link. If you have employer-sponsored insurance, COBRA, a private policy, which is a policy that is paid for you or another entity, or a plan through the marketplace, you must submit your previous year's W-2 and at least one of the following: your most recent month's pay stubs, such as a 4-week, 30-day period, notice of award for SSI or SSDI, a notice of award from the Michigan Department of Health and Human Services, SSA, notarized statement from an employer showing gross pay for the last 30 days, an unemployment benefits award, corrections release papers within the 30 days of release, or a declaration of support. If you are self-employed, submit a copy of the previous year's 1040 federal tax forms, signed and dated by either you or a licensed preparer, along with a copy of your Schedule E form as proof of income. If you have no income, you must apply for Medicaid, the Healthy Michigan Plan, or the Adult Medical Program at your local Department of Health and Human Services office before you submit the application to MiDAP. To apply for the Healthy Michigan Plan, you can apply in person by visiting your local Department of Health and Human Services or by calling 1-855-789-5610, or you can apply online at www.healthymichiganplan.org. When you apply for Medicaid or the Healthy Michigan Plan, you will need to provide the date you applied on the MiDAP application and submit your tracking number with the application. If you have any questions, please call the MiDAP office at 1-888-826-6565 or call Ken Pape at MDHHS at 1-877-342-2437. Lab update. You will need to provide your viral load and the date of your most recent test result, which must be within the last 6 months, and your CD4 count and date of your most recent test result. Your most recent test result must be within the last year or as indicated by your physician. Insurance information. If you have prescription insurance or medical insurance that requires you to pay a copay and or a deductible at the pharmacy, there are a few additional documents that you will be required when you submit your application. Private insurance. If you have employer-sponsored insurance, COBRA, a private policy, which is a policy that is paid by you or another entity, a plan through the marketplace, or coverage through the VA, you will need to make a copy of both sides of your prescription card and submit it with your MiDAP application. Now we are going to cover Medicare. But first, how do you know if you're eligible? You are eligible for Medicare if you're 65 years or older, if you or a spouse worked for at least 10 years for a Medicare-covered employer, and if you are a citizen of the United States. If you are not yet 65, you might also qualify for coverage if you have a disability or end-stage renal disease. End-stage renal disease is a permanent kidney failure requiring dialysis or a kidney transplant. To be eligible for copay assistance, you must be enrolled in a Medicare Part D or a Medicare Advantage plan. If you're currently enrolled in a Medicare Part D or Medicare Advantage plan, then you must apply for the Low Income Subsidy Extra Help Program. Additional information on the Low Income Subsidy Program can be found in the presentation resources link labeled Low Income Subsidy. If you are currently enrolled in a Medicare Part A or B plan, but not in a Medicare Part D or Advantage plan, then you do not have to apply for the Low Income Subsidy Extra Help Program. If you need more information about applying for a Medicare Part D or a Medicare Advantage plan, please visit the presentation resources link labeled Medicare Plans. When submitting your MiDAP application, please make sure to include a copy of your Medicare prescription card and a copy of your approval or denial letter for the Low Income Subsidy or LIS Extra Help Program. If you have no insurance, you must apply for Medicaid, the Healthy Michigan Plan, or the Adult Medical Program at your local Department of Health and Human Services office before you submit your application to MiDAP. Now you have all of the information you need to include when you submit your annual recertification for MiDAP. At this point, we're ready to walk through the application itself. When you are filling out the application, be sure to print as clearly as you can. The application begins with demographic information, which is information about you. Question 1 asks for your MiDAP ID number, which you can find on your MiDAP ID card. Your ID number is the 8-digit number that is written in the white space above your name. Question 2 asks for your legal name, which is the name listed on your government-issued form of identification. On the first line, print your legal last name. If your last name is hyphenated, they should both be on this line. On the next line, print your legal first name. If you want to write in your nickname, please feel free to do so in parentheses. The third line is for your legal middle name, if you have one. Write out your full middle name. If you only have a middle initial, just put the initial. Leave this spot empty if you do not have a middle name. The next line is for a woman's maiden name and should only be filled out by a woman who has gotten married and changed her last name. Print all previous names as well. The next line is for an alias if applicable. For example, an alternate identity or appearance. For example, if you're transgender but your legal name does not match your current gender identity, you can use the alias space to write your preferred name. Question 3 is to identify your marital status. Mark the box that fits your status. You should mark only one box. Question 4 asks for your current mailing address and phone number. Enter the address where you would like to receive mail from the Michigan Drug Assistance Program. If someone else receives your mail for you, put their name in the space above the address line. Proof of residency must be submitted with your application. Examples of acceptable proof of residency are provided in the resources list. Question 5 is asking for your phone number and if MiDAP may leave a voicemail on the number that you provide. If you check yes, that we may leave a voicemail, MiDAP staff will only state they are calling from the state of Michigan. At no time will a MiDAP staff member leave any private or confidential health information when leaving a message. Question 6 is where you write your Social Security number. Without this, your application may take longer to process. In question 7, you will write your date of birth. Make sure to include the month, day, and year. For question 8, check the box that matches your biological sex at birth. For question 9, check the box that matches your current gender, male, female, or transgender. Pharmacies require gender information to fill your prescriptions. If you checked transgender in question 9, move on to question 10 and check the box that fits your current transgender status. If you are not transgender, skip on to question 11. Question 11 asks whether you are pregnant. If you are not pregnant, check the no box. If it's possible that you may be pregnant, but you are not sure, mark the box unknown. Males can check the box for not applicable. That completes all of the demographic questions. Now we will move on to the next set of questions. These refer to the stage of your HIV. In question 12, check the box that indicates your current stage of HIV. You will only check one of the following boxes: HIV positive, AIDS status unknown, HIV positive, not AIDS, third stage HIV, CDC defined AIDS, or unknown. If you checked the third box, third stage HIV, CDC defined AIDS, move on to question 13. If not, you may move on to question 14. For question 13, enter the month, day, and year of your third stage HIV, CDC-defined AIDS diagnosis date. If you don't remember the exact date, you can estimate the date as best as you can. Now we will move on to the household size and income section. Question 14 first asks for your household size. Household size includes you, your spouse, and any dependents under the age of 19 that live with you. This number should include only you and anyone you claim on your federal taxes. The next section asks you to identify all sources of income. Check the box for all sources of income that you have. On the line after the income source, list the total gross monthly income for that source. Gross income means the amount of money you earn before taxes or other deductions. This is also called the pre-tax amount. If you do not have any income, you are also required to apply for Medicaid or the Healthy Michigan Plan benefits before applying to MiDAP. You will also need to include the date you applied, including the month, day, and year. Also include the tracking number that Medicaid provided to you when you applied. Remember that when you submit your application, you will also need to include proof of income. Question 15 is asking for you to provide your viral load and CD4. Your viral load must be filled in with the most recent lab values, which must be within the last 6 months. Your CD4 must also be filled in with the most recent values, which must be within the last year or as indicated by your physician. That completes the lab update section. Now we will move on to the question about your prescription and medical insurance coverage. Question 16 requires you to identify your source of medical and prescription coverage. If you do not have either form of coverage, check the no box and move on to question 17. Remember that if you don't have any coverage, you are required to apply for the Medicaid or Healthy Michigan Plan benefits before you apply to MiDAP. If you do have prescription or medical insurance coverage, check the yes box in the first section and check all of the boxes below that identify the types of coverage you have. This information can also be found on your insurance card. For example, if you have Blue Cross Blue Shield through your employer, you would check the employer-sponsored insurance box. Then where it says name of carrier, you would write down Blue Cross Blue Shield. Next, you would write down the ID number, the RX bin number, the RX PCN number, and the RX group number in the blank spaces provided. All of this information can be found on your insurance card. If you don't have your insurance card or you cannot find it, you can contact your insurance company to get this information. Be sure to make a copy of your card and attach it to your application when you submit it to MiDAP. That completes all of the prescription and medical insurance information. Now we will move on to the question about which type of coverage you are requesting from MiDAP. For question 17, there are 3 options of MiDAP coverage that you can select from. You will check only one in this section. Your options include full drug assistance, copay assistance, or Medicare copay assistance. I will go over each of these so you will know which one is the appropriate MiDAP coverage you will need to request. Number 1, you will check the box for full drug assistance if you do not have any other insurance or if you are uninsured. This type of assistance indicates that you are requesting that MiDAP pay for your medications in full on behalf of you because you do not have and you are not eligible for insurance or prescription coverage from any other source. In this case, you must apply for Medicaid, the Healthy Michigan Plan, or the Adult Medical Program at your local Department of Health and Human Services before you submit your application to MiDAP. If you are requesting MiDAP pay your out-of-pocket copays for your prescriptions, you would check copay assistance and then check the appropriate corresponding type of insurance. The types of insurance include employer-sponsored insurance, COBRA, a private policy, which is a policy that is paid by you or another entity, a plan through the marketplace, which is a qualified health plan or QHP, or coverage through the VA. A copay is the amount you would usually pay at the pharmacy. If approved for this coverage, MiDAP would act as your secondary prescription coverage and pay your copays on your behalf after your primary insurance pays for their portion of the prescription claim. You would check the box for Medicare copay assistance if you're asking MiDAP to pay for your out-of-pocket expenses associated with your Medicare Part D prescription benefits. Be sure to check the box for which type of Medicare you are requesting. Medicare copay assistance means that you are asking MiDAP to pay your Medicare out-of-pocket expenses. This is any amount that your Medicare Part D plan requires you to pay in the form of a copay or deductible after your Part D plan pays the portion they are responsible for and after any low-income subsidy, extra help assistance is applied to your prescriptions, if applicable. If approved for this coverage, MiDAP would act as your secondary prescription coverage and pay for your copays on your behalf after your insurance pays for their portion of the prescription claim. That was the last question of the annual recertification application. However, your application is not complete until you sign and date the bottom of page 4. Please read this page thoroughly, as this is the consent form and authorization for release of information. MiDAP cannot process your application without your signature. If you have a case manager, please write his or her name, agency, and phone number in the spaces provided. This completes how to fill out a MiDAP annual recertification. If you have any questions, please feel free to call the MiDAP office at 1-888-826-6565 or refer to the MiDAP website at www.michigan.gov/DAP.